The Hyperbilirubinemia and Neurotoxicity Risk Assessment is used to help providers risk stratify newborns who could potentially develop hyperbilirubinemia or jaundice and neurotoxicity. This assessment is performed on newborns between the ages of 12 and 146 hours. The ENGINUITY tool uses pre-existing information within the chart to pre-populate the assessment, saving the user time and reducing mouse clicks. According to the guideline recommendations set forth by the American Academy of Pediatrics, every newborn should be assessed prior to discharge for developing hyperbilirubinemia. The AAP guidelines also include phototherapy recommendations with hour-specific treatment thresholds that have been built directly into the ENGINUITY tool. Similar to the online Billy tool, the ENGINUITY Hyperbilirubinemia Calculator will identify at-risk newborns and provide real-time, patient-specific recommendations. The calculator also screens for neurotoxicity risk and allows for documentation of the 24-hour nomogram. Upon entering the assessment, the newborn's delivery date and time will auto-default in. We also see the last lab result for serum bilirubin, as well as data collected from the newborn admission assessment, like feeding method, gestational age, and other data elements. Simply by hitting my Enter key, the age and hours will auto-calculate. Combined with the information gathered on admission and the last recorded serum bilirubin, the calculator updates with a risk level, risk category, and recommended follow-up. From here, I can select the appropriate orders from the order sheet, or the ENGINUITY tool can queue them automatically. I can use the guide to add the appropriate frequency within the ordering session. In this case, I want to evaluate the patient for phototherapy and check the serum bilirubin levels within 4 to 24 hours. I am able to document on the 24-hour nomogram directly from this assessment as well. By selecting the nomogram, it launches my annotation tool, in which I can select a tool, a color, and annotate directly on the chart. In this case, my patient is 22 hours old, and they have a serum bilirubin of 7.20. The last part of the assessment evaluates the baby's neurotoxicity risk. Updating the significant lethargy question triggers Galen problem drivers to update the risk factors with information from the patient problem list. Notice here that it looks like the patient has acidosis and hemolytic disease defined on their problem list. I can verify this by checking the problem list. The patient's last recorded albumin lab result will also pull into the calculator automatically, and from here calculates my neurotoxicity risk level, which in this instance is high.